After months of being in the eye of the storm over claims of mismanagement of COVID-19 funds, the Kenya Medical Supplies Authority KEMSA appears to have jumped out of the frying pan into the fire following a probe conducted by the Office of the Auditor General. The Auditor General's report shows that KEMSA was at the center of misappropriation of billions of funds meant to fight COVID-19. Among the irregularities is the utilization of the Universal Health Coverage UHC and capital budget to fund COVID-19 related procurements without approval or authority, contrary to Public Finance Management Act 2012. The special audit further identified that KEMSA commenced COVID-19 related procurement processes without approved budgets. Pre-delivery samples were evaluated and communication given to suppliers to schedule delivery to KEMSA warehouses if accepted. There were, however, no controls and procedures undertaken to confirm availability of budgets before committing the suppliers. The audit also established that COVID-19 related items worth 8 billion shillings were irregularly procured. An age analysis conducted by the Nancy Gathungu-led special audit team established that 97% of COVID-19 items have been at KEMSA warehouses for more than 3 months. According to the report, it is therefore clear that KEMSA overprocured COVID-19 related stock without an objective assessment and forecasting of the existing demand for the products. The report further showed that KEMSA awarded tenders worth 1.26 billion shillings to companies that had been in existence for less than 1 year. Companies which, according to the Auditor General, had no necessary qualification and experience to supply specialized medical supplies. Among the companies, as outlined in the report, is Shop and Buy Limited that was awarded a tender worth 900 billion shillings to provide KEMSA with KN95 face masks and personal protective equipment PPEs. Kilig Limited that won a tender to provide PPEs worth 9 million shillings and Nanopay Limited that won a face masks tender worth 349 million shillings.
We established that procurements amounting to Kenya shillings 871,640,000 were made from firms that were not pre-qualified and therefore did not demonstrate adequate experience in dealing with medical products. For example, Kilig Limited and Shop and Buy and Nanopay Limited were registered on 22nd January 2020 and 14th February 2020 and 22nd August 2019, respectively, and yet they were awarded contracts.
KEMSA has already suspended 3 top officials, among them the authority's CEO John Manjari, as the probe intensifies. David Muthoka, TV 47.
Moving